Pets with perineal hernias will demonstrate a swelling adjacent to the rectum or one or both sides, coupled with signs of constipation, difficulty defecating, lethargy, difficulty urinating, and altered tail carriage. If you want to know more about this condition, stick around because we will talk about the clinical signs, diagnosis, and treatment of perineal hernia. Welcome back, guys. My name is Doc Ratio, and every week we post videos, cases, topics, and tips on how to better take care of your fur babies. And this week we are going to talk about perineal hernia, its signs, diagnosis, and treatment. But before we proceed, please hit like, subscribe, and the bell button so that you get updated for whenever we post new videos in our YouTube channel. We are on Facebook, Doc Animal Wellness Center, and we are also on Instagram, Dr. Animal Wellness Center, and my personal Instagram, Ratio. So on with our topic for today. What is perineal hernia? Perineal hernias result from the weakening or complete failure of the muscular diaphragm of the pelvis. Normally, the pelvic diaphragm kasi allows for rectal support and keeps the abdominal contents from encroaching to the rectum. Pets with perineal hernias will demonstrate a swelling adjacent to the rectum on one or both sides, coupled with signs of constipation, difficulty defecating, lethargy, difficulty urinating, and altered tail carriage. Yung buntot hindi niya maitaas because wala na nga yung muscle doon, no? The underlying cause of weakening or failure of the pelvic diaphragm is unclear at this time. However, many theories are proposed, all of which may be working separately or in unison to allow the pelvic diaphragm weakening or failure. The disease primarily affects older pets, usually between the ages of 7 to 9 years. Non-castrated male dogs and cats are also overrepresented. Pets with perineal hernias typically demonstrate a swelling adjacent to the anus or on one or both sides. The swelling may contain herniated abdominal and pelvic canal contents such as dilated rectum, prostate, urinary bladder, fat, omentum, and small intestines. So what we have here is actually a perineal hernia, no? Yung muscles supporting the perineal region have weakened in time. So herniate yung abdominal contents into this area. A few years back, we already repaired the right side. Now it's the left side that's already actually affected, no? So we're going to do the same thing. We're going to close this using the muscles here in the leg and close it there, no? So para matibayan natin ulit. Clinical signs in pets with perineal hernias are related to the organs entrapped in the hernia. Typically, these signs include constipation, straining to defecate, kapag yung colon o yung naiiwan doon, straining to urinate or inability to urinate if the urinary bladder is concerned. Urinary incontinence also because of the pushing of the organs, no? Abdominal pain, lethargy, depression, anorexia, and the likes. Also, one of the most significant clinical signs is the altered tail carriage because of the effect on the muscles involved. To diagnose perineal hernia, your veterinarian will perform a thorough rectal examination. This will help to determine the presence or absence of a mass-like lesion, prostatic disease, contents of the hernia, and to determine unilateral or bilateral disease. Yung ibang patients may require analgesic or sedative administration for the completion of a rectal examination. Kasi nga, hindi mo basta-basta sila may examine because they're already in pain. Doing the examination will further institute resistance from the animal. Your primary care veterinarian will likely recommend a complete blood count, biochemical profile in our case, Chem 17, and urinalysis to determine any concurrent systemic illness. Advanced diagnostic imaging such as ultrasound and abdominal radiograph or contrast media through radiograph may be recommended to help determine the hernial contents. bladder position and size, colon position and size, prostate disease, or patients demonstrating any swelling adjacent to the rectum, along with the clinical signs mentioned earlier, should seek veterinary advice as soon as possible. Organ entrapment into the perineal hernia may be life-threatening and necessitate emergency stabilization prior to definitive surgical intervention. Kasi nga, kapag may natrap na segment ng intestine dun sa area na yun and it cannot go out, baka magkaroon ng local necrosis and will have bigger problems. So, your veterinarian may wish to refer you and your pet to a veterinarian who is experienced in performing a surgical repair of a perineal hernia. Perineal hernias by themselves may cause constipation, which in turn may damage the motility function of the colon. Perineal hernias may also disrupt your pet's ability to urinate. Occasionally, excessive straining may cause the urinary bladder to retroflex or flip backwards into the pelvic canal, leading to urinary obstruction and potentially loss of blood supply to the bladder. Entrapment of a loop of intestine into the hernia may cause significant pain and loss of blood supply. Emergency surgery is indicated for pets with signs of abdominal pain, inability to urinate, and a strangulated loop of small intestines. How do you treat perineal hernia? Treatment of non-emergency perineal hernias may consist of either medical or elective surgical therapy. Medical therapy is indicated for preparing a patient for surgery, but is generally unsuccessful at permanently controlling the disease process. So, temporarily lang yon. Medical management will consist of a combination of enemas, stool softeners para hindi magbara doon yung dumi, IV fluid therapy in cases of dehydration, dietary management, and analgesics for pain management. Surgery is aimed at repairing the pelvic diaphragm and potentially suturing or tacking the colon and the bladder to the abdominal wall to help prevent recurrence and colon or bladder entrapment. The surgery typically involves placing sutures to restore the pelvic diaphragm and the incorporation of an internal obturator muscle flap to bolster the repair. So may areas doon sa area ng hip bones which yung muscles will be used to close or to rehabilitate the pelvic diaphragm. The internal obturator is the muscle that is elevated from the floor of the pelvis. Plastic surgical mesh may be implanted in more severe cases. Mas madalas kong ginagamit yung surgical mesh because usually pag dinadala sa atin galing na sa ibang vet, it is the second procedure already. The muscles here are too weak. We are just going to put a mesh dun sa loob itong unit na to function as the muscle, no? In order for this to hold the intestines dun sa loob, no? The abdominal contents so that it won't go out and herniate. Ito ipapasok natin. It may also be necessary to transfer a flap of muscle from one of the rear legs to aid in closure of the hernia defect in severe cases or cases that have failed initial repair. It is recommended that all patients be castrated during the surgical procedure to help decrease the risk of recurrence. During initial hospitalization, all patients are monitored for complications. Should complications arise, medical or surgical interventions may be recommended. After surgery, your pet may be placed on a broad-spectrum antibiotics. All patients will receive pain medications to reduce their post-operative discomfort. Dietary modification with high-fiber diet coupled with stool softeners are sometimes used to help with reducing the pain and straining associated with defecation because dudumi sila and kapag matigas yung dumi, mas painful. Usually, hinuhold na nila yung kanilang pagdumi, becoming eventually constipated. No? So your pet should be kept in a calm and quiet for the first 2 weeks after surgery to allow the tissue healing. Elizabethan collars or E-collars are warranted to prevent patient's damage to the surgical repair. Cold compress applied to the surgical site may be recommended to help diminish swelling and the perineal irritation. The prognosis is good for the majority of the cases. However, 10 to 15% of the cases, recurrence of the hernia may occur within a year. Prevention of overactivity and self-trauma may help lower this recurrence rate. There is no proven means to prevent perineal hernia from forming. The problem is rarely seen in castrated male dogs, so early castration in dogs not intended for breeding purposes is recommended. If you have further questions on perineal hernias, please visit any of our Docford's Animal Wellness Centers in Timog, UP Town, and North EDSA, and call the numbers posted here or log on to our website at www.docfordsawc.com. This has been your vet, Doc Fritz Resho. See you again next week.